Hi, my name is Faraz Ali. I am a clinical research fellow at Cardiff University, and I was the lead author of this systematic review. For a patient suffering with psoriasis, quality of life improvement is as important as improvement in clinical signs. We know that health-related quality of life instruments are increasingly being utilized as outcome measures in assessing interventions. These include generic, specialty-specific, and disease-specific instruments. With this systematic review, we wanted to identify randomized controlled trials of any therapy in psoriasis that have assessed quality of life, and to evaluate patterns of utility and reporting of quality of life data. We included randomized controlled trials of any psoriasis treatment using at least one quality of life instrument. All adults with any subtype of psoriasis were included. We followed PRISMA guidelines for our search strategy, and we searched 6 databases with almost 400 search terms. After this, the abstracts were reviewed independently by 2 separate assessors. I was one assessor myself, whilst the second assessor was a visiting research fellow, Andrea Cueva from Ecuador. A third adjudicator, Dr. Atwan, resolved any differences of opinion. We also assessed the risk of bias using both the JADED scale and the Cochrane risk of bias tool. We found that reports of psoriasis trials that met inclusion criteria have gradually increased over the last 20 years. We screened over 3,500 publications, and of these, 99 articles describing 100 trials met inclusion criteria. Altogether, these studies reported data on about 33,000 subjects. 33 trials tested topical therapy, 18 for systemic, 39 for biologics, 9 for phototherapy, and 10 tested other interventions. Overall, 13 different instruments were used, and of these, the DLQI was the most commonly used and was reported in over 80% of studies. This was followed by the short form 36, Eurocol 5D, Psoriasis Disability Index, and Skindex. We also found that there was widespread inconsistency in the way that quality of life data was reported. For example, just over a third of trials reported minimal clinically important difference, otherwise known as the MCID. This is the minimal change in score that is considered of clinical relevance and should be considered as part of efficacy data. Furthermore, we found that many studies did not fully report quality of life data, often substituting this with incomplete graphical representations. This systematic review identifies commonly used quality of life instruments for patients who suffer with psoriasis to aid clinicians in day-to-day practice. Furthermore, it highlights the increasing need for guidelines to be developed in the way quality of life data is measured and recorded in clinical trials. Though minimal change in quality of life scores is clinically important, the question arises of whether intervention endpoints should target perfect quality of life rather than demonstrating a measurable improvement.